Welcome, everybody, and thank you for joining us today. We are here with Dr. Tyler Johnson, who is an associate professor and medical oncologist at Stanford Healthcare. So let's get started with patient support and well-being. What should patients that are newly diagnosed with GI cancers know about their condition?
Well, that's a really complicated question because when I am seeing patients for the first time, I will often tell them, and it's true, that cancers are quite literally as unique as the people who have them. And the reason that that's the case is because cancer arises from a mutated version of your own DNA. And since, unless you have an identical twin, your DNA is unique in all the world, it is literally true that your tumor is also unique. And so, we talked earlier about the questions that we try to answer to determine what is the best treatment for a given patient. We have to think about all of those, sort of how all of those come together into then determining how are we going to treat a given patient, and that determines what a patient's experience is going to be like. And so some patients who are diagnosed with a cancer, depending on the cancer and where it is and what it looks like, it can be as simple as a single dose of radiation and then they're done. And for other patients, they undergo a treatment course that involves chemotherapy, radiation, surgery, and all of that happens over the course of, sometimes as long as 12, 18, 24 months. And so the most important thing is to make sure that you're at a place where the doctors have expertise and a lot of knowledge to make sure that you get the appropriate kind of care. And then you have to talk with your doctors to find out exactly what that care is going to look like.
What are three questions that patients should be asking their doctors if they get diagnosed?
So the first thing that I would probably ask is the tumor in a place where it can be cured or not? The second would be, if it can be cured, then I would ask, what does the whole arc of treatment look like from beginning to end? How long is it going to take? What components is it going to have? What kind of side effects is it going to have? All of those kinds of things. And then if it's in a place where it can't be cured, then to ask for just a sense of sort of how treatment is going to play out over time.
How do you help patients and their families navigate the emotional and psychological aspects of living with the diagnosis?
Yeah, so that's a really good question. I think that, the hope, of course, is that medical oncologists, the doctors like me, will do some of that. I think it's also important to know, though, that there are a lot of other team members who can also help with that. So, a lot of oncology teams, for example, will have social workers or other additional team members who can help with those concerns. And then, in addition, many patients will see a psychologist or a psychiatrist. And then one of the most important things to know is that most medical oncologists, like me, work in collaboration with other doctors who are called palliative care doctors. And palliative care doctors have received special training to be attuned to and able to help with some of those psychological and spiritual and emotional concerns.
You often talk about spirituality in medicine. Given your expertise in treating GI malignancies, which are conditions that impact not just the local areas, but as mentioned, the interconnected systems as well. Do you think that this perspective has greatly influenced your approach to patient care?
Yeah, I think a way of understanding that is to, in my mind, when we talk about spirituality, we can mean a lot of different things, right? Some people go to church, for example, and that's the way that they express spirituality, but other people express spirituality differently. But I think one of the things that sort of binds together all of the many different expressions of spirituality is that when we are talking about spiritual things, we're talking about kind of the big questions in life, right? Where did I come from? Why am I here? Where do I go after I die? What's the meaning of life? All that kind of stuff. And I think that oncology is unavoidably connected to those kinds of questions, right? Because if you have a person um, who is very sick, I think that it's very difficult to be really sick and not ask yourself a lot of those really basic questions. And so I think that having some kind of spiritual or even religious grounding can be really helpful to people who become very sick. It can also provide a form of community, right? If you have some kind of a spiritual community that has known you for a long time, that can be really helpful as well.
Similarly, are there any specific resources such as like support groups or educational materials that you in particular recommend for patients to better understand and manage their condition?
So, some patients feel that things like support groups are really helpful. Others feel like not so much. So that sort of depends on the patient. But I think having someone to talk to about what's going on, whether that's your partner or a family member or a close friend or a support group or what have you, is important. And then I think in terms of information, the most important thing is to make sure that you have reliable information. So what you don't want to usually do with cancer is just like go online and type in, colon cancer and see what comes up because some of the information will probably be reliable and some of it probably won't be. So for example, there's a website called cancer.net that has sort of validated, verified information. And then there are other, depending on your situation, you can talk with your doctor about getting other reliable resources.
Transitioning into the prevention aspect and like thinking about long-term health, what screening measures do you recommend for patients that are at a higher risk for GI cancers, like those with a family history of these types of diseases?
The only screening test that is validated for pretty much everybody for GI cancers is a colonoscopy starting at age 45. However, having said that, there are some populations where other screening tests can also be considered. So, for example, people who are either from Asia themselves or whose ancestry comes from Asia are at higher risk, for example, for gastric cancer. And so, in the United States, we still generally don't have screening per se for that, but that's something that you would certainly want to think about, especially if you had symptoms, and maybe even if not, you consider talking with your doctor about that. And then, if a person has a family history, for example, if a family member has been diagnosed with, let's say, colon cancer at a young age, let's say you have your dad was diagnosed with colon cancer at 40, then you would want to talk with a doctor because generally we will recommend starting screening then for that kind of cancer many years before when your father was diagnosed. The last thing I'll say is that there are also some populations that have a higher risk of chronic liver disease, things like hepatitis and cirrhosis. Patients who have hepatitis or cirrhosis should also receive an additional kind of screening test. It's an ultrasound for a particular kind of liver cancer. And so that's something they would also want to talk with their doctors about.
Are there any specific lifestyle changes you suggest to patients to help lower this risk of recurrence or any new cancers?
There is a long list of such things, and most of them you will probably not be surprised to learn are basically the things that doctors are always telling people to do. So, for the most part, it's things like maintaining a healthy weight, staying away from tobacco and any kind of smoking, getting good daily exercise. We usually recommend at least a half an hour of cardiovascular exercise a day, eating less red meat, eating lots of fruits and vegetables. There's a couple of kind of funny ones like eating a lot of tree nuts, it turns out, is good for preventing colon cancer. Some patients, but only with the consultation, under consultation with a doctor, can take a daily baby aspirin or maybe vitamin D. And then another thing that is starting to get more press in the last few years is avoiding alcohol. If you want to reduce your risk of colon cancer in particular as much as possible, it's probably true that no alcohol is the best amount to drink, but if you are going to drink, it's probably better to have it be a treat rather than a thing you do regularly.
Great. Thank you so much, Dr. Johnson. That's all the questions we have for today. It's been a privilege meeting you, and once again, thank you.
Thanks so much, Linuki. It's been great to be with you.